Hi, I'm Anthony and I'm a paramedic, and today I'm going to demonstrate to you how to do a standing takedown on a patient using a spinal board. The first thing we need to do is take up spinal control on the patient. Okay, don't move your head left or right or up or down when answering any questions. Do you understand?
Yes.
Okay. I'll then get my assistant DMT to take up C-spine control.
On. And on.
I will now apply size and apply a collar to the patient. I'm just placing the collar on you again for precautionary measure. Is that okay, Keith? Yes? Excellent. Once the collar is in place and you're happy, you then get your spinal board, place the spinal board in behind the patient. When the spinal board is in place, take over C-spine control from your partner. On. Let your partner position himself on his side of the patient. He then places one hand on the patient's head, so there's always 2 points of contact on the patient's head. Then place my hand on the patient's head, where I'm able to also grasp the spinal board. That way, C-spine control is maintained at all times. For the purpose of the demonstration as well, it is good to have a third person stand with his foot at the feet of the patient so they do not slide forward. Okay, prepare to lower and lower. Gently lower the patient towards the floor. Excellent. This is going on. If you find that the patient is too low on the spinal board and you need to move them up, you will slide the patient in a direct upwards position, never from side to side. This concludes doing a standing takedown of a patient.